What are some treatments for breast cancer, doctor? So are there any new treatments? I know we're going to touch upon a few of them, but are there any new ones coming up?
There are many new treatments for breast cancer. It seems that almost on an annual basis, we're learning more and more about the treatment of breast cancer. And really, it's moving in a direction that's becoming more and more personalized.
Which is fantastic, because
yes.
one size doesn't fit all, and I'm glad they're doing that kind of approach, especially with breast cancer. There are many treatments. I'd like to show our viewers a few of them right now. Radiation therapy, doctor, can we talk about that?
Yes, so the treatment of breast cancer, as it says up there, is multimodality. As the surgeon, I usually am the first step for the patient, but they also need to receive, most of the time, radiation, possibly chemotherapy, possibly endocrine therapy on top of that. And so it's really multifaceted, and it's me along with a team of doctors that are treating these patients.
And what is proton beam radiation? I've heard of that.
Yes, so it's a newer type of radiation that we actually offer at the Miami Cancer Institute. And it's a way to target the radiation treatment specifically to the tissue and avoid scatter effect to the heart and lungs. And so, in left-sided breast cancers, let's say, the left side of the chest wall is very close to the heart and lungs. And when you give the traditional radiation therapy, there is some risk of scatter to the heart and lungs. And now there's ways to overcome that. The radiation oncologist may have the patient lean forward or hold their breath during the treatments, and that will avoid some scatter to the heart and lungs. But in patients that really need to avoid that radiation to the heart and lungs, proton beam therapy is basically like pencil beam therapy, where the radiation is extremely precise and hits that tissue and then does not scatter.